Dr. Rajesh Fogla, he doesn't need any introduction. He is going to talk to us as a new technology. It's a Zeimer Z8, which you can do on a cataract as well as on a cornea. Dr. Rajesh.
Well, thank you. I think I'll rush through the presentation because the session is till 12:15 and we have 3 more speakers to give the talk. I'll talk about my experience of the Z8. We have been using the Z6 for the past 9 years and we acquired the Zeimer Z8 last year. It's a truly versatile, portable femtosecond laser. Does a wide variety of procedures. How is it different from the other lasers? It has a articulated handpiece which comes very close to the eye. So you don't need to bring the patient to the laser machine, but the arm piece, the handpiece, you can dock it on the eye. It works on a low energy pulse, which is overlapping and very high frequency, and thereby it ensures that there is minimal tissue damage. And also integrated OCT also helps us during the procedure, that once we have applied the handpiece on the eye, we can do a corneal OCT to look at and adjust the treatment that we are performing. You can do refractive surgery like LASIK. You can do the clear procedure, which is the lenticle extraction. You can make the stromal pockets. You can do lamellar keratoplasty, penetrating keratoplasty. You can do intracorneal rings. There's a special software for DALK, and you can also do the cataract surgery, the femtosecond cataract surgery. Now, we have been using the LASIK flap for several years now, and the best part is it is very, very reproducible. We use minimum thickness of about 100 microns and gives a perfect flap every time with a very smooth interface. And you can customize the edges to various configurations to ensure that you get perfect fit of the flap. The recently introduced lenticle extraction, the clear procedure, you can see that it works equally well as compared to the other existing laser systems in the market. You do the 6.57 millimeter zone of treatment, and finding the anterior and posterior plane is very easy. And once you optimize the laser energy levels, you find that there is minimal resistance to the dissection, both for the anterior and posterior plane, and you can very easily remove the lenticle from the eye. That's how the cornea looks the day one after the clear procedure. And if you look on retroillumination, the interface looks pretty smooth. That's on the OCT thickness maps. You can see very well-centered treatment. On the cross-section, also very smooth interface. And if you look at the day one topography difference map, you can see very well-centered treatment. And on the AR, you can see the values are almost 0. That's our initial treatment when we did. Even the learning curve is very smooth. If you're starting off with a nomogram, still a majority of your patients are achieving 6.6 with minimal residual refractive error. In terms of doing a DALK procedure or a PKP, it's very good. You can customize the edge incision. You can make mushroom, top hat, zigzag configuration, and you can do the big bubble DALK. You can, and the best part is that once you have, you can, even the donor can be customized to the shape that you want. You can see there, it's a top head configuration, so it fits very well. The advantage is that it gives you minimal astigmatism and a faster visual recovery following the surgery. We have been using the rings and the stromal segments using the femtosecond laser. The best part is you can customize each segment. You don't need a circular, similar opening. You can make a different pocket for an inferior segment and a different pocket for a width pocket for a superior segment. And it has all the various parameters for the Intacs, the Kera rings, the Ferrara rings, and you can even manually customize the inner and outer diameter and the width of the pocket that you make. For introducing the stromal segment, I use a metal template, a ring, onto which with the stromal segment is sutured, and then when you pull out the metal ring, the stromal segment quickly goes into the pocket, make it very easy to implant the same. We have also been doing stromal lenticule insertion for keratoconus, where we cross-link a lenticule that's also prepared with the femtosecond laser. Then you make a pocket, and then you can pull in a lenticule into the pocket, and thereby it increases the central corneal thickness, and thereby later on you can go ahead and do a topo-guided PRK to achieve a much smoother corneal contour. in terms of doing the femtosecond cataract, you can keep the laser machine in the OR next to your microscope, so you don't need to shift the patient between the laser and the microscope. It can be without moving the patient. You can make your clear corneal incision side ports, which you can see in this case, despite the arcus, it made very nice openings. I've also done an arcuate keratotomy to treat some of the cylindrical power. You get a free floating rhexis. You can make 4 to 6, 8 segments with ring segments as well. And once you do that, it significantly reduces the overall phacoemulsification power delivery. The segments can be broken, and you can do that, ensuring a good central rhexis and good centration of the IOL as well. I'm just running through the videos because of lack of time. I have to be in another hall for an instruction course. And so basically, the Z8 femtosecond laser, it's the only portable femtosecond laser with multiple clinical applications ranging from cataract, refractive, and cornea. You can use it for vanishing keratoconus. You can use it for even surface reconstruction procedures. They have shown videos of being used in pterygium surgery to prepare the conjunctival flap, and also in limbal transplantation, both to harvest the limbal segments and for transplanting them into the cornea. So thank you for a patient hearing.
Thank you, Dr. Rajesh, for finishing in time, so we can give a time to the other. This is what we say is a portability of the laser. So you can just take it from an elastic room to the cataract near the microscope, and then again take it to the